Hi, my name is Jordan Fleming, and I have decided to do an informative speech about plastic/cosmetic surgery. The purpose of this speech is to inform and enlighten people about plastic surgery. Fact: about $16.5 billion was spent on plastic surgery in 2018. That's about $45.2 million spent per day and $2 million spent per hour, which equals to around 520 per second. As cosmetic surgery continues to gain popularity, I feel like the myth of it being done solely for vanity purposes misrepresents those who just want to feel quote unquote normal. I have personally thought about getting some cosmetic surgery. Although I have never personally received any invasive cosmetic procedures, I have gotten some minimally invasive procedures such as microdermabrasion. Today we'll be discussing 3 key points about cosmetic surgeries. 1 being the different types of procedures, 2 being the growth in the industry, and 3 being simply mental health. Now that I have given you a general overview about what plastic surgery is and what it means to me, I will now focus on the various procedures. There are 2 main categories that separate the procedures. 1 being minimally invasive procedures such as Botox, fillers, and laser hair removal. The second being cosmetic surgical procedures such as breast augmentations, rhinoplasties, and facelifts. From patients with facial deformities such as cleft lip and cleft palate, they tend to receive some of these surgeries to help repair the affected area. Some patients tend to need to receive tip rhinoplasties to repair the tips of their noses caused by their facial deformities. Now that you have a strong understanding about the types of plastic surgeries, let's talk about the growth of the industry. The growth of the plastic surgery industry is increasing each year according to the American Society of Plastic Surgeons. Since 2000, overall procedures have gone up 115%. In 2015, men accounted for more than 40% of breast reduction surgeries. That's 35% more than in 2000. Men also receive Botox and breast reductions to allow themselves to feel more confident and younger in order to keep themselves competitive in their career fields. The most common plastic surgeries in teens are breast enhancements, rhinoplasties, and ear reconstruction. Although breast enhancements shouldn't be done until the patient is at least 18 years old or until they finish maturing, unless it's being done to fix a deformity or an asymmetry. The overall growth of the industry has to do with social media, the affordability of it all, and the health benefits, which people don't normally talk about because nobody talks about how Botox can help relieve migraines and help with hyperhidrosis. Now I will show you a chart with the top 5 cosmetic surgeries done in teens. So now that we understand the growth of the industry, let's discuss some of the mental health effects. Mental health is a reoccurring topic in many aspects of one's life. The common misconception about mental health in plastic surgery patients is that people are coming in trying to change themselves, when in reality, good doctors consider a person's mental health before they agree to perform any type of surgery. Not every patient has low self-esteem. Some just want to enhance or preserve their natural features. Some have been dealing with some of the same issues for their whole lives and they just want to change it. Some people have body dysmorphic disorder, but it only affects around 1 to 2% of the general population. But it's 15 times more prevalent in those seeking plastic surgery. Those who have body dysmorphia only focus on their negative features, which explains why they seek plastic surgery and why they tend to go overboard. When you're constantly seeing something wrong with you, wouldn't you want to change it? Now, granted, your mental health can be affected negatively after cosmetic procedures, but most of these factors go with any surgery, such as the effects of general anesthesia and pain medication. General anesthesia can remain in your body for up to 3 weeks after surgery. The residual effects include lethargy and depression. A vast majority of the narcotic painkillers are in a class of drugs considered depressants. Although in most medical procedures you do not wake up looking bruised and battered, after getting surgery to repair your nose, if you saw yourself and you saw all this swelling and that you had 2 black eyes, would you be happy about your results immediately? I would say probably not. So now I'm going to show you a chart about how many people have body dysmorphia in just the general population, and then how many people have body dysmorphia in plastic surgery patients. There are many types of cosmetic procedures that can be done, and some people may not even consider as truly plastic surgery. Over the past 20 years, the industry has grown into a multi-billion-dollar business. And as far as mental health, only negative stereotypes of mental health tend to be associated with this industry, which has been proven that isn't always true. Before drawing conclusions about as to why a person may elect to receive plastic surgery, think about the various other reasons that one may decide to do so. Many people's lives have been changed for the better due to cosmetic surgery. Having chosen to have a cosmetic procedure, I can attest that it's not solely about vanity, but sometimes it just is a self-esteem boost. Thank you for watching.